Hello, my name is Caleb Smith with the Rocket Miner newspaper, here with an update looking at the latest scores earned by Memorial Hospital of Sweetwater County. The Centers for Medicare and Medicaid Services maintains a Care Compare website that lists both the overall score and patient scores that various healthcare facilities earn on an annual basis. Some time ago, the Rocket Miner was tipped that the Sweetwater Memorial had been warned that its score was potentially going down. It took us a while to confirm this, but after it was mentioned in the hospital's regularly scheduled meeting, which the public can attend, virtually in this case, and through documents and contained in that meeting's agenda, detailing the work of multiple hospital committees, preparing for a potential change in score. We printed the story saying that this was a possibility, though at the time it was noted that the Centers for Medicare and Medicaid Services, or we're just going to go by the acronym CMS from here on out, sometimes they do change their number between what their preliminary number is that the hospital had been told about and what the actual numbers were. Wednesdays, the scores were out, and the hospital noted that after maintaining a 4-star rating for the previous 2 years, presently it's now has an overall rating of 2. The customer service rating stayed a 3 that it's been for the last while. There's a lot to unpack here, and I give credit to the hospital for providing an in-depth look at the ratings process, what goes into it, areas where the hospital was dinged, and what the hospital's been doing to improve. We're not going to get into all of it, but if you want to get more, the story's posted at rocketminer.com. Just kind of looking at the big picture stuff, the CMS star rating system, which ranks from 1 to 5, and 5 being the best, has dozens and dozens of categories that are measured. It's been in the process of revising how it scores hospitals, and that's a potential factor in how things were changed. 5 main groups that it looks at when it's scoring a hospital are mortality, safety of care, readmissions, did they get discharged and then end up back in the hospital again, patient experience, and timely and effective care. And within that, there's, like I said, more than 65 measures that they can look at, though they keep changing that number as well. The latest refreshed version only looked at 48 measures, which, like I said, that's still 4 dozen by itself. That's a lot of things that it's just trying to do to be able to compare an across-the-board number so that you can compare apples to apples, hospitals, similar hospitals to one another. Quoting from Sweetwater Memorial CEO, Irene Richardson, she said, "My goal is to get us back to a 4-star rating by the end of this year," she said. "We believe this is not a reflection of the quality of care we provide our patients. We're taking an even closer look at improvements and opportunities." Now, the scores that were released this month are based on 2019 figures. Previously, Richardson has said that if the number can drop 2 stars in 1 year, we should be able to change it in that much. One thing that was noted by staff in some of their committee meetings is the fact that 2020, endemic to being the year where the coronavirus pandemic reared its head and disrupted a lot of things, was extra troublesome for hospitals, where normal day-to-day proceedings were uprooted and honestly in some areas have not returned to the norms that were established before. There were quite a number of procedures that were canceled or at least postponed. With things improving, the hospital's been encouraging people to get back on track, make up for that lost year. But there's been some worries that there either won't be numbers coming this next year, just because 2020 was so just abnormal in so many different ways, or if just because the schedule was so disrupted that the number wouldn't change beyond what it is. The press release notes that the hospital has a plan in place to meet or succeed benchmarks by December 31st, 2021, with there just being about a 2-year difference in that. That would, if they do that and improve to the degree that they're aiming for, if not better, that would return to a minimum 4-star rating by the 2023 star ratings refresh, as they call it. Like I said, that will be 2023 will be the one based on this year's data. There's a lot more talking about different areas where the hospitals are reviewing what they're doing. Some of this has been a long-term goal. Their multi-year plan included having as high a possible star rating, and so in some cases they're just continuing what was already in plan. In some cases they're trying to add a little bit more to it. Certainly there's been a lot more time for reflection, contemplation, brainstorming. One of the things that was just generally noted both by the hospital and some medical professions, some of the larger groups that kind of umbrella over that, is that a single grade is not representative of what the hospital is or can do. It doesn't capture all its knowledge, all its potential. I certainly, as a student growing up, I had 1 or 2 cases where I'm telling my parents, I'm doing much better than what that grade indicates. Some cases there were just a fluke or stuff that figures that hadn't been turned in on time, and my grade in the class at present was not does not match what it was during the time when the grades were recorded in the report card. And that's part of what the hospital is saying here. It's that they've been working to improve things since then. They have more pressure to do so. This is the type of thing that our residents in this community expect the highest possible care that they can get. I think that we have a lot of motivated people locally in our healthcare system throughout Sweetwater County, both in public practice, private practice, aiming to do so. And I'm hopeful that they get back to the numbers that they feel are better reflexive of what they want to do, what they can do. We'll be watching this. Like I said, this is the type of thing that it may take a year to turn around. It may take even longer. But the Rocket Miner will keep following this story, providing updates, doing what we can to bring you the news and the context. When we receive this tip, being able to kind of put it into place in the greater picture of what the scoring system was, what are some of the things that need to be improved. Those are some of the things that we waited to run with the story. And the hospitals been at the time when we first contacted them, they noted that there could have been the difference between the preliminary score and the final score. I will give it credit. They've had a press release ready, and it wasn't an hour between when I contacted them this morning saying the CMS website has revised its number. When can we anticipate a response? And that came out there, and I was in a meeting at the time, but we still got it posted as quickly as we were able to read it ourselves and get it out there. I know a number of people who work at the hospital in varying different levels, and I know they have felt this change in scores. It's going to be something that's going to be consciously on their minds for a while, and I believe that they will use it as motivation to do better. In the same way that I've seen other people in our community, when they get a check like this, when they get a challenge like this, they steel themselves, they try to learn, and they aim to do better. And we'll see what we can to help them with that. This is Caleb Smith with the Rocket Miner, wishing you a good day and a safe tomorrow. Bye.